Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture is the personality disorders. So how do we go about and define this condition is again very important. It's basically a group of mental illnesses in which the patient has these rigid thoughts and that particular delusions that he's suffering from. Now what basically happens over here is that these particular delusions and these thoughts are going to reflect in his or her behavior as well. So his behavior is going to be affected as well, and sometimes this effectiveness is to the level that his normal day-to-day life is affected through this behavior, and even he is not able to cope up with the normal stresses and the work stresses of his life. The people who are surrounding these people who are suffering from these particular kind of personality disorders are also affected by their behaviors as well. So it's very important to go about and treat these people who are suffering from these particular kind of personality disorders that we're going to discuss in the subsequent sections over here. So when we talk about the classification, how do we go about and classify these people who are suffering from personality disorders? It's again very important. The definition, what is the highlight of the definition is the thought process or the thought content of these individuals. That is going to reflect in the behavior of these individuals. So this group of disorders is sometimes, it remains undiagnosed in a lot of individuals. They do not seek treatment in a lot of cases, but it's very important to treat these people to be more fruitful and to be more helpful for the society that they're dwelling in. So the classification is again very important over here. The major classification is we're going to divide these people into the three chunks, that is the cluster A, the cluster B, and then we have the cluster C individuals. Primarily the people who are belonging to the cluster A group are the people who are more odd and eccentric in their behaviors, and then we have the cluster B group in which we have the more aggressive kind or the more emotional kind of people suffering from the borderline personality disorders, and then we have the cluster C group in which they have the extreme worry or the extreme fearfulness, and that is basically observed in their behaviors of the OCTs or the schizotypal behaviors as well over here. So the categorization of these people who are suffering from the personality disorders and what are the basis of their categorization, it's basically their primary aspects of behaviors that we'll be discussing in this very first section. In the second section, we'll be moving on to the cluster A individuals primarily. Over here, we have the paranoid individuals. They have the delusions of persecutions in their surroundings. And then we have the schizoid individuals, primarily the people who are suffering from the schizotypal individuals as well as the schizoid individuals will be discussed over here in this second section. In the third section, we'll be discussing the people who have the cluster B individuals, that is the impulsive. Then we have the borderline individuals. Usually the people who have the borderline personalities have suffered some sort of a child abuse or sexual abuse in their childhood. So the childhood history is very important over here. And then we have the histrionic individuals, and they are more aggressive and more emotional in their behavior as well. In the fourth section, we'll move on to the cluster C individuals, and over here, if we have a comprehensive look at the individuals, they have an avoidant behavior, they have a dependent behavior, and then they can have an obsessive compulsive behavior. So all of these behaviors are the results of the extreme worry or the extreme fearfulness that they have in their minds, or the thought components are basically of the anxiousness that are leading them into that avoidant, dependent, or the obsessive compulsive behaviors primarily over here. So in the fifth and the final section, we'll be moving on to the management guidelines, and that will be basically the general management of these individuals. Obviously, the designation of the treatments would be according to the clusters of the groups that they're belonging to. And then we're also going to move on to the cultural considerations over here. And then the treatment guidelines, it can range from the psychotherapies, from the counseling sessions, and even it can involve the pharmacotherapies coupled with the counseling sessions. So this will be the summarized view of the management guidelines of the different people belonging to the personality disorders over here in the different clusters of individuals over here. So I hope you want to learn more about these personality disorders. So do watch the other sections to this lecture as well.